Yeah, what's going on? I hope you guys are doing okay. This is Dr. Reese. I'm using this platform to be able to discuss things regarding the heart, health, and prevention. Um, just using a few minutes, hopefully 20 to 30 minutes, just to answer any pressing questions anybody may have in regards to their heart, in regards to their health. Um, for those of you guys don't know who I am a cardiologist. It took me 14 years to get to where I'm at right now, and so I enjoy to use this platform to ask any pressing questions in hopes that I can hopefully prevent someone from having a heart attack. All right, just making sure the audio is okay. So, why this is extremely important is that one of the things that we try to stress the importance of is understanding what the risk factors for heart disease are. This includes things like hypertension, high cholesterol, diabetes, strong family history, smoking, and just not following up with your medical provider. If we There it is. I was hearing an echo. It was myself. If we can treat these underlying risk factors, we can potentially prevent a heart attack from happening. So, my goal, my aim is always to try to discuss these things, um, because far too often people will come into the hospital after they've had a heart attack, and they always believe that either they or such and such was healthy their whole life. It doesn't make any sense why they're having heart disease now, when in reality they've probably had heart disease for a long time, and they're just now being treated for it. An unfortunate scenario, because the now is after they've had a heart attack. So while I wait for you guys to come on in and ask some questions, one of the things I'm going to do is just answer any potential questions other people may have. So one of the biggest questions people always ask me is, how can you prevent a heart attack? How can you prevent heart disease from happening? And it comes, like I said, with understanding what the risk factors are, things like high blood pressure, diabetes. So if you treat those risk factors, you um, prevent the heart attack from happening. Why is it important? Not just heart attacks. You have things like strokes, heart failure, kidney failure, needing to be on dialysis, and the extensive amounts of income people spend on a monthly basis with medications, with hospital visits, that you can use for other means. Anyone who's popping in, just let me know where you're coming from. Let me know what questions you may have regarding your heart, regarding your health, regarding prevention. And if you guys don't have any questions, that's all right. I'm gonna just do my due diligence and read some echoes, read some EKGs. An echocardiogram is an ultrasound of the heart. It lets us look at how well the heart is squeezing, but it also lets us know if there's any fluid around the heart. It can sometimes let us know if someone is going to develop heart failure a few months before they do, um, which gives us an inclination to start treating them early, start looking at what they may be doing that may be affecting their heart. So today was my outpatient day, but more than outpatient, I'm also the echo reader. So reading a few echoes, fortunately had to finish seeing all my patients first, and now it's the only time that I have to be able to read these echoes. So doing my due diligence and just knocking them out one at a time. Each echo can take anywhere from 3 to 5 minutes. Some of them can be really quick, but it can be very taxing to the body, just being that I am tired. Sometimes the echoes don't always have the best images. Thankfully, this one does. Can let me know how well the heart is squeezing. Mm. There it is. That's what I wanted to do. Got it. My hopes is that I can finish these echoes and have enough time to hang out with the family. Give it a little bit more time. So, common thing that I see in the hospital or in the outpatient setting is people who have chest pain. So, chest pain, welcome to the person who come in. I'm talking about chest pain. My name is Dr. Isa. I'm a cardiologist. Let me know where you're coming from. Let me know if you have any questions regarding your heart. But chest pain that is concerning to a cardiologist is chest pain here, pain that moves to the shoulder, but more importantly, pain that gets worse whenever you're stressed or and improves with rest or medication called nitroglycerin. If you have any of those symptoms, you may be having cardiac chest pain, and we want to further investigate that with things like a stress test, sometimes an echocardiogram. But if it's scary enough, we may actually want to do a cardiac catheterization. We do that so that we can end up looking for blockage. And when if you do find blockage, then we can open it up with a stent. The caveat is that if we find a lot of blockages, then we usually want to reserve that for open heart surgery. That's known as coronary artery bypass graft or CABG. For those, welcome. Let me know where you're coming in from. And let me know if you have any questions regarding your heart, regarding health, regarding prevention. My name is Dr. Atang, cardiologist. If you don't, thank you for dropping by.